Since we've already talked about a bunch of stuff using Botox fillers or preventing it by using sunscreen, we're going to talk about how to treat things. Because if you haven't listened and you haven't prevented, like a lot of us that haven't, now it's our turn to help you kind of remedy these problems.
Definitely. And, future episodes, we can talk about regenerative medicine and the things that are on the horizon. But for now, I think we're going to focus on minimally or non-invasive facial rejuvenation. And so the idea is there's, again, kind of three major categories. We can reverse volume loss, collagen loss, and pigmentation. And so really, maybe we kind of group these things under brightening the skin, all the things that we can do for that. Tightening the skin, all the things we can do for that. And then maintaining your skin. I think that's going to be one of the most important things, because after we either perform treatments or do anything that we can to get your skin to where you want it to be, you've got to maintain. And so that's where, a good skincare regimen, facials and things like that are going to become extremely important.
Guys, listen, you hear what he says? Just because we can make the spots go away doesn't mean you should go get more. So the key to it is fix it, but prevent it from coming back, and then maintain that glow. Maintain what you've had done, just so this isn't something you do over and over again, because it becomes costly and redundant.
So if you had a patient that comes in and you immediately see these things, and let's focus on one thing right off the bat. We're going to look at brightening the skin and evening out skin tone, reducing pigmentation, things like that. How do you normally start someone, and then where do you end? What are the options? We can talk about the levels of damage and what we're really capable of.
It's like any patient. First, you have to sit there and assess their goals, because what we want to do for everyone, not everyone is out to have. But we're going to, for argument's sake, for today and for today's podcast, we're going to say best case scenario for everything. We're not going to say, this person doesn't want to do this, or so forth, so on.
Sure.
So first and foremost, I really kind of see lifestyle. What are they doing? Are they doing anything to cause these problems? So if you're smoking cigarettes, I'll make you stop that. If you're drinking way too much, make you stop that. If you're not sleeping enough, we'll make you stop that. Now, if that's just a part of your life, then we'll deal with it and we'll fix it. But generally speaking, we have to do that first. Then set you up with a really good pre-skincare regimen. And with that said, I'm a huge fan of using retinol and using something like that to cause cellular turnover. Our bodies we're kind of like lizards, but not really. But we shed skin, and we actually have tools of helping you shed that skin faster to get you ready for some of our procedures. So, just like you do for your own skincare regimen and your wife, and you kind of give this recipe for all the patients, what we need is a good cleanser, a good toner, a good vitamin C serum, and I keep going on about this, but generally speaking, something with a retinol. So I love Triluma, because what it does is there's 3 ingredients. We've talked about this in another podcast. There's a retinol, there's a hydroquinone or kojic acid, and a low dose steroid. What this does is it really prepares your skin for something. Now, you don't need to have a procedure done after this. It'll make it look good regardless, but this will prevent some of the possible complications of some of the procedures that we want to set you up for.
Sure. So let me take you through this first. Let's say, I'm going to give you some scenarios here. Let's say, so we're talking about brightening the skin, and I've got a 38-year-old Fitzpatrick 2. So we're looking at classifications. The lower the number, the whiter you are. The bigger the number, the darker you are. And each one of these types of skin types, so they're from 1 to 6, they have different options on what can and cannot be done. So let's say I've got 38-year-old Fitzpatrick 2. So she's not quite redhead, but blonde hair, blue eyes, tons of dyschromia or discoloration of the skin. And she comes in, she, post-pregnancy, she has melasma, and she's saying, what are my options to get rid of this melasma and some of these dark spots?
Excellent question. And now this is a very open-ended question, only because we can use multiple different modalities. And the question is, what you want to set the patient up for is how many treatments, how fast, and how effective. Now, there's melasma is
Where would you start? Where would you? Because I know this is. I threw a difficult one at you right away.
Melasma is a very difficult thing to take care of. In my opinion, and through my experience, I have seen that the Cosmoland peel has been incredible. Cosmoland peel is a peel that has a bunch of different things in it. Basically, it's a dark peel. It's brown in color, which isn't very attractive. But you put it on for the day, all over your face, and then the next day your face peels and you're a little swollen. It really leaches out the melasma. Melasma is not just regular pigment. It's a hormonally mediated pigmentation disorder that is caused not by direct sunlight. It is caused by hormones, pregnancy, and just heat. You can go outside and it could be hot, and you could be under an umbrella and you can have melasma. So I'd start out with Cosmoland because I find it to be very, very effective.
Let's say they come to you and say, all right, I'm going to make it even more difficult. I'm going to say, I don't have the downtime. I can't do the 4 or 5 days of peeling that occurs with a Cosmoland peel. What can I do on a daily basis to slowly help brighten my skin?
So daily basis, I'll go right back to Triluma.
Okay.
And Triluma, and I normally like to start Triluma every other or every third day. Sometimes it's very harsh on people's skin. People overdo it. It should be a dime size amount, very small because it's very potent. And it's something we use, and you will see your skin brighten right before your eyes. It is incredible. And it works very well.
Do we have any laser that we can use that can help with zero downtime, that can help melasma as well?
So of course, the best laser, hands down, without a question, for any type of pigment, whether it's produced or you actually had someone put it in your body like a tattoo, is the Pico laser. We have the Pico 4 laser by Luminous. There are other types of Pico lasers as well. It's an ND YAG type laser that works really well. And you can turn it down so you can bring someone in a little more frequently, give them treatments that don't require downtime, and really help get rid of melasma and other sunspots and other areas as well.
What about, let's say, same scenario, 38-year-old, Fitzpatrick 2, so very, blonde, blue eyes, that has really more rosacea, but it leads to that blotchy appearance of the skin. Is there anything that we can really do?
Little different, but again, depending on what you're looking for. Now, again, I personally love, some people will use other types of erbium lasers. I love the IPL because of the fact that it has the lowest amount of downtime. It's really easy to use, and the comfort level with it is incredible. So you can use IPL on sunspots as well, and some vascular lesions and rosacea. I wouldn't really use the IPL for melasma because I don't think it's as effective.
All right. Let's switch it up. Let's say 38-year-old, but now it's African-American. So this is going to be a Fitzpatrick 5 or 6. And same thing, comes in, they've got dyschromia, a lot of blotchiness of dark colors and things like that. Now what do you do?
Interesting. You can use the Pico laser because the Pico laser is really, really good for really all skin colors. You just have to know how to use the Pico. And the rule of thumb, if there's any plastic surgeons or any practitioners listening to this and they're curious, rule of thumb is always do a test spot, always start with the lowest energy because you can always step it up. But the problem is if you do something that's kind of going to cause problems with a much higher level, then dialing it back after doesn't make any sense. So the Pico works very nicely. I think the Cosmoland with dark skin works really nicely as well.
And I agree with you. That's the great part about those two modalities because, everybody says, oh, listen, I can't have a laser. Well, the reason why the Pico 4 laser works so well is because the pulse duration is so fast. It's a picosecond. That it doesn't have enough time to generate heat, which really, that's the issue. And that's what causes hyperpigmentation in a lot of people who are in the higher Fitzpatrick scale. And so it is an option for every single skin type. Same thing, the good part about the Cosmoland, as you mentioned, it's great for every skin type because it leaches out the abnormal pigment, not the current healthy pigment.
Absolutely.
And really all pigment is, imagine it's like a little umbrella. So when the sun shines, the cells in our body, the melanocytes, secrete, or I should say metabolize the form of melanin, and it really serves as a protective barrier. And so when we develop that pigmentation, in the summertime, it may look nice and golden brown. Really what it's doing is trying to protect all of the cells and the cellular elements. And so as we develop pigmentation when we get older, this is damage to the DNA. So all of these procedures, again, I want to preface by saying we can improve the pigmentation of the skin, but it's always going to come back because the DNA has been damaged. Now, again, we'll talk about in the future the regenerative capabilities of stem cells and things like that. We may disprove that, but right now, current therapies are showing, listen, if you do an IPL or a laser or something like that, you'll slowly start to see those spots come back, especially if you don't maintain or do anything to keep the skin where it's at.
Now, is this the same way we would treat just regular sunspots? Somebody comes to you and says, look, I've got sunspots on my face and I have them on my hands. How do we treat those?
Yeah, listen, the good part about some of the lasers that we do have is that we can use what's called an Nd:YAG. It's either Q-switch. They have different chromophores, and so we have two different wavelengths that are used. So our particular laser has a 1064 nanometer, which is more for darker pigments, or you switch over to 532 nanometers, and that's more for reddish, reddish brown or reddish orange lesions. So usually these spots, although there is a little bit more downtime, it will ablate some of the darker or remove some of the darker pigmented sunspots. And so we just use that 532 nanometer and it frosts white initially, then it'll slowly turn red. It will kind of dry up and flake off, and then that pigment should be gone. Sometimes it may need more than one session, but usually in a single session.
Sometimes it even works for some flat moles. You come in and you really don't like a mole on your face and you want to have it removed. Instead of cutting and leaving a scar, sometimes using this laser works as well.
Another option is, I think is amazing technology. We've been using it more and more. We were sold on the cryoprobe, which is liquid nitric oxide. It tends to be very comfortable because it's not as cold as liquid nitrogen. And so we use that for different raised lesions on the face or moles or dermatofibromas and cysts. And what it does is it freezes the issue, creates this, kills some of the cells, creates an inflammatory response, and the body can slowly chews it up from the inside. And so that's another option for a raised mole. In fact, I did it to my own arm just as a test. It works.
No, it is. It's great. It's the closest thing to magic that we have, honestly. I've used it for some lesions and very, very happy about it. Now, when you do these procedures, obviously, it's very important that after, let's say you get treated for your melasma and we get rid of it, it's very important to obviously wear sunscreen. But there are adjunct skincare regimens that will help as well. And I know you have some favorites. What is it that you like to use after they're all healed up from doing melasma treatment or any type of sunspot treatment to the face?
Yeah, I think, listen, it depends on the amount of injury that's done to the skin in order to get it there. But I always think that a vitamin C serum or cream or something that has high concentrated vitamin C, in our line, it's the dark spot corrector. And so just by using that, it's involved in collagen turnover, collagen formation, and it also helps brighten the skin. It, reduces tyrosinase, which is the enzyme responsible for creating melanin and pigmentation. And so, I think anything that we can do to help limit the amount of pigmentation formed is always a good thing. So a good vitamin C serum is always great. And then obviously sunscreen over the top because you're going to be ultra sensitive, especially in the beginning.
And again, remember, guys, melasma is not just a disorder of pregnancy or of sitting in the sun. It can happen. It can be activated very easily by just heat. So some of it you just can't get away from. And don't be frustrated. There are solutions.
So we talked about brightening the skin. Now let's bring it to tightening the skin. And this is one of our favorite topics because, everybody comes in and they say, oh my gosh, you have to fill my laugh lines or you have to fill this, add filler. But what everybody keeps forgetting is how important the quality of the skin is. And after age 18, we lose 1% per year of collagen and elastin. And after a certain point, do the math, you're going to cause what's called dermal collapse. So I can't tell you how many patients come in, and I'm sure they do the same for you. They say, 6 months ago, I did not look like this. And that's probably true because at some point...
And you're like, what were you doing for the last 6 months?
And then it's true because at some point, you've got, let's say, 25% collagen loss, all of a sudden you hit that precipice and suddenly it's just downhill from there. So let me give you the other scenarios.
But it's interesting what you just said. You said that regardless, there are ways to tighten the skin. Now, I know you do a lot of facelifts, right? Mm-hmm. So it's interesting. Dr. Layke, when he does a facelift, he uses a laser outside the skin, on the skin for every single patient. Mm-hmm. Interesting, because you can lift up everything from the inside, but if you don't resurface the outside of the skin, then what's the point, right?
Yeah, listen, everybody forgets the skin envelope. I think there's no doubt that performing the facelift and adding fat and doing these things helps improve the underlying structure. But if you don't fix the outer aspect, the covering that everybody sees, you've really done yourself an injustice. And so the idea is that at the same time, you want to give a second chance to the skin. So, back to performing a laser, basically microscopic punches to the skin, almost like aerating a lawn. It improves collagen formation and ablates or removes some of the outer dusty layers of the skin. So, and that's why I think what I'll do is this time I'm going to come up with scenarios just a little bit different, because for all the listeners out there, let's say you're not 38, let's say you're 58. You're not ready for a facelift, and you say, all right, I've got let's go with a 53-year-old Fitzpatrick 3 right in the middle. That means that, you burn sometimes, you tan easily, and you are looking to tighten some of the skin. Let's talk about some of the options. How do you start? You look at someone, you say, all right, we've got moderate sun damage. They already have sunspots and things like that. So, obviously that's something that you're considering. They have volume loss, so you could potentially think about other things to help fill. But how can you tighten the skin? What's your go-to?
So interesting. A great question. And over the last couple of years, there's probably, 30 devices that are the exact same thing almost. Mm-hmm. And they all do relatively the same thing, but they're named different and they have a little kind of nuance that's different. Now, my go-to lately for everything for skin tightening is Morpheus. Mm-hmm. Morpheus is a microneedling device that we talked about in other podcasts that has radiofrequency heat at the end of it. Now, the beauty of it is it's relatively safe for all skin types. And it's become such an amazing go-to cosmetic treatment that, we use Morpheus, but there's also something called Profound. There's something called Halo. And again, there's multiple other companies that have made a very similar device because it works and it's really, really good. Now, the only downside to this, Morpheus is a great device. It can be done for the face and for the neck. It can be done for the arms and the body as well. And it's there to tighten skin by causing collagen production. The only downside is that you have to do a couple sessions. The beautiful part about it is there's minimal downtime. Mm-hmm. So you may be red for a day or two, even if we get real aggressive, but you're back at it and you could be in public without a problem.
Sure. I think, listen, it was so funny. You had mentioned it earlier. There are about 30 different machines. They all kind of do the same thing. It was originally, where we had monopolar technology, which was one electrode, and you would arc-ish, areas to create heat, slowly using the skin as a resistor. Then there was bipolar technology, where you basically had an anode and a cathode, and you had energy traveling between two areas. Then you had tripolar technology. It was starting to get crazy. The idea is that, radio frequency is really the electrical form of heat. And we already know, we've talked about in the past, that aerating your lawn is like microneedling. You're creating damage, but now you've added an extra element. You've denatured proteins and you are forcing collagen stimulation. So again, if we're losing 1% per year, what a better way than to try to regain 1% or 2% than to undergo these types of treatments. And so, listen, it doesn't mean if you do it 30 times, you're going to go all the way back to the way you were at 18. But the idea is, we're looking at different areas of the face, how you can, really help improve the thickness of the skin by stimulating collagen.
And interestingly enough, like I said earlier in this podcast, is we can take the same type of modality and use it anywhere on the body. Now, obviously, it's a larger surface area. It takes, it's a longer treatment, but it can cause skin contraction in mostly anywhere. Is it going to be as noticeable as it is on the face? Depends. Most likely not as much because, again, a little bit on the face goes a long way, whereas if you've got hanging skin from your arm, it may need to be cut out, but it's a great way to really tighten the skin.
Especially, listen, for those of you listeners who are anywhere from 45 to 75 and you have that crepey skin to the neck, it's one of the most difficult things to get rid of, even when we perform a neck lift. We pull it nice and tight, but the problem is you've already lost the collagen and elastin. So, it's not like you're going to keep your head in a vice. You are going to move and nod and you're slowly going to start developing some of that crepiness. So one great thing to do is the Morpheus or microneedling or anything to thicken that skin. Another go-to favorite of mine, and you mentioned it earlier, is my facelifts. Everybody except for Fitzpatrick 4, 5, and 6, darker skinned individuals. Again, that's, we're using a scale, Fitzpatrick 1 to 6, and your skin gets darker and darker as the number goes higher. But my favorite is the fractionated CO2 laser. It is just a phenomenal device. We know a lot about it. It used to not be fractionated, which means it used to be a straight CO2 laser, carbon dioxide laser. And the chromophore, the target, was water. And it would blast the skin and really force collagen stimulation. The problem was it also removed some of the pigmentation. So now a fractionated version of that means now instead of hitting an entire square, now it's more like a checkerboard. And so the idea is there's less damage and much less chance of losing all pigmentation. And so, I visually see the skin tighten in front of me. And one of the best places to use this is around the eyes. That thin skin, I can see it just shrink in front of me, especially under the eyes and even the upper eyelids. So that's a great spot.
And it's interesting when he says about the old CO2 lasers, it really would make people look white. And that was a big complication. Funny thing is, some people loved it. So
yeah, you always see,
but it was splotchiness. It was weird.
Yeah, you would see these people who are 80 years old who had facelifts 30 or 40 years ago, and you would see a white line all the way along the jawline, and the entire face was white, but then the neck would be darker.
Absolutely.
So just looked a little funny.
The only downside, again, and let's talk about fractionated CO2 laser. Great laser. Can we do it in an office setting? Yes. Can we do a full face aggressive fractionated CO2 laser without anesthetic? I wouldn't recommend it. Most of the time, to really get the results we're looking for, and if you see some of the facelifts that Dr. Layke does after, there's a significant amount of redness and swelling for about a week, sometimes even 10 days. So
I always say you're going to look like you're in a house fire for a week. But I do say that, out of the hundreds I've done, there hasn't been a single person who wishes they wouldn't have done it.
Exactly. And it's hands down the gold standard for tightening lower and upper eyelid skin, especially the lower eyelid. When you do a lower eyelid surgery where you take the puffiness of the bags under the eyes, conventionally years ago, we cut that extra skin out. Now, with really good technology, we can just tighten the skin without any incisions. And that's really a go-to for the fractionated CO2
Yeah,
lasers.
in fact, it's very rare now that I make an incision under the eyelid and remove that extra skin. Usually what I'll do is make hidden incisions inside the lower lid, remove some of the puffiness under the eyes, and then laser over the top of it, and that tends to work wonders. There is another option. So let's say you are a Fitzpatrick 4, 5, or 6, darker skin or African American. I would say that a chemical peel is a great option.
Sure.
A tricyclic acid or something like that, where you put on for 3 minutes or less, also tightens the skin, but it doesn't really have the thermal injury that a laser would. So it tends to be a little bit of less hyperpigmentation. Doesn't mean it can't happen, and that's why we pre-treat with Triluma. But again, we tailor our treatments per patient, per skin type. It's really custom made.
Absolutely. And with the peels, there's a variety of peels. We talked about the Cosmolam peel earlier for melasma. There's TCA peels, there's glycolic peels, there's light glycolic peels, there's heavier glycolic peels, there's phenol, there's crotonine oil. There's a ton of different peels. Jesner's. We don't use as many peels as we used to in the past because, in my opinion, I do think that our technology is phenomenal. However, are there people that come in sometimes and say, hey, listen, that peel works for me, I'm going to stick to it, and you say, hey, we're not going to recreate the wheel today. We'll use exactly what we used before and get the really nice results.
Definitely. So we've talked about brightening the skin. We've talked about tightening the skin. Now, how about maintaining your skin? And I think it's not just skincare, although we will touch on that, but what can you do? So now I'm giving you another scenario. We say you've got a 55-year-old or 60-year-old patient that comes in, Fitzpatrick anywhere from 1 to 6. They've already had their facelift or they haven't. They've had a particular treatment or laser or peel or whatnot. What do we do now to preserve the skin, improve the skin, and simply maintain it?
Well, it's my favorite. It's called the red carpet special. I love using the hydrofacial. I think, there's a lot of different types of facials. And you can just do the old school conventional esthetician who just gives you a facial, who basically cleans your pores and then gives you a nice little hot towel, maybe gives you a little LED light, then you go home. We've been using the hydrofacial for years now. And what I like about the hydrofacial is it does two things. It cleans and then it plumps. So what you do is you first literally clean the skin with a device that sucks out all the pores. It really kind of cleans you up. And then you infuse hyaluronic acid back into the skin to give you that really nice plump look. What I've noticed is over the years, now we do live in Beverly Hills and we are at the mecca of Hollywood. Right before any big award ceremony, we have patients that come for this because it makes them look rejuvenated. Now, this is something I recommend if people can do once a month. It's phenomenal. It keeps them hydrated. It keeps their skin looking fresh and clean. It takes about 40 minutes, 0 downtime, and you look phenomenal. So my big thing about maintaining what you've had done is do that. Now, at the same time, let's say you come back and you do a hydrofacial, and there are a couple tiny little dark spots. Well, our esthetician can just zap that with an IPL, or we could take you into the room for a little pico laser and get rid of those in maintenance as well.
The one thing that we didn't touch on, and you made reference to it in the fact of the hydrofacial, is that it forces hyaluronic acid into the skin. And hyaluronic acid can hold 1,000 times its weight in water. So that is why adding volume, it's the one thing that we did not touch on yet. So volume loss as aging occurs. There are several fat pockets in the face, some atrophy at different rates, and there are tough ligaments that hold things in position. That's why we develop the tear troughs, the nasolabial folds or laugh lines, and the creases or jowls. We call them labiomental creases or marionette lines. And so the goal is really to reinflate what's been lost, not to add significant amounts of volume. It's really to add little bits of volume in the form of, normally I would say the majority are hyaluronic acids. There are a few other products, calcium hydroxyapatite. We've got, multiple different, options, L-polylactic acid. But let's say the majority of fillers are hyaluronic acids. They tend to have the least amount of complications. They can be removed if you don't like them. And so using that principle that it can absorb 1,000 times its weight in water, we have 1 cc syringes. Now, 1 cc is not a large amount, but we really can correct some of the volume deficiencies in the face just by adding small amounts of volume. And so, one thing that I would say, one of the most common things is people come in and say, oh, you got to fill my laugh lines. Well, that's not really the correct treatment protocol. Because really what happens, the face, if you hold your hand in front of your face, right in the center, everything falls around that. That's why jowls form. That's why the nasolabial folds form. That's why the tear troughs form, because everything kind of falls, around that area. So really what we want to do is fill central and lateral on the outside. So you want to add volume to the center part of the cheek and all the way out to the cheekbone. because that's really where you're losing volume. And
So think about what he's saying. It's kind of like a V. Keep going. It's exactly like a V.
Yep. And that you fill that portion first, and you'll see a partial effacement or smoothing of the laugh lines or some of the other lines.
One of the simplest way to think about what Dr. Layke you just said. We age like a little capital A, so it's all going down. And the way you want to fix it is by putting it back up like a V. And the way we inject the face is like that too. So if you can build the cheeks up, it'll suspend everything back up. It's kind of a simple way to think about it, but that's how we do it.
All right. So again, we talked about brightening the skin, tightening the skin, now adding volume. We can go back to maintaining. You had mentioned the hydrofacial, and I agree with you. I think it's just a fantastic thing to use, especially right before an event. Your skin will never look better. It's just, it forces that hydration into the skin. You'll have that glow, and you'll probably need less, cover up or foundation and things like that.
Perfect for brides, perfect for the mother of the bride,
Well,
perfect for
right.
anybody who's having any type of event. It really does make you feel, and on top of it, look a lot better.
And the interesting part, and I know you can attest to this is not just for women. This is for men too. Long gone are the days where we age like fine wines. The only reason that's true is because our skin is 40% thicker than females. So we just, tend to age at a slower rate because of that fact. It eventually hits us all, but that's really why in our middle years, we tend to look a little bit younger than females can. But a lot of these procedures, especially over the last year, I would say our practice has probably increased by 300%.
Absolutely.
And so I think it's everybody who's seen themselves on Zoom says, all right, wait a sec, something needs to be done. But this is where skincare comes into play. Men, women, we're looking at maintaining what we have. And what's the earliest age you can start? Well, I don't know if there is an earliest age, but again, I alluded to it before. I said, listen, we wear sunscreen as babies, so why wouldn't we prevent certain things from happening when we're younger? So is it okay to wear moisturizers? Listen, as long as we're not causing acne, I think once we're out of our post-adolescent years, now we really want to take care of our skin. So what do you think you would recommend as far as maintaining your skin?
Yeah.
And it may just be as simple as washing your face.
We'll keep it really simple because I keep it really simple. I don't use a lot. I love a skin polish, some sort of exfoliant. Now, I'm not telling anyone to use this every day. My favorite is our skin polish. I think it's one of the best products we have. Anybody who uses it is absolutely amazing. I like using it probably every other day or every third day. I use it on my face, but some people have other issues where they use it on their arms or they use it on their backs, and it really does help. So I like an exfoliant, and then I like a very mild cleanser. I have both of these in the shower. I use them every morning when I take a shower, and then every night before I go to sleep. And I think that's important, especially for women, okay? Women, listen to me for a sec. The reason you get acne or the reason you get problems is because you don't wash your face properly when you have makeup on. The makeup doesn't cause it. It's when you keep it on overnight. So something to remove makeup that's not really harsh on your skin. Alcohol tends to really dry the skin, so watch out. Great way to clean the skin, but it does dry the skin. And then I'm pretty simple. I just use a moisturizer and I'm good to go. There's a great nighttime eye cream that we have that kind of helps thicken the skin under the eyes. And then there's another great thing to add to your armamentarium is using a vitamin C serum. Our dark spot corrector is great. Lastly, out of all the stuff that we have and I like to use, the Brighten Tighten really does give you a nice glow. I use it during the day. It depends, what other people want to use. Now, when you look at a skincare line and when you want to formulate one, you make it for the masses. Me, on the other hand, I don't use that much. But again, you figure out what works for you. And that's the key. Every single person's a little bit different. So for me to tell you, you have to do my regimen, well, that doesn't make sense. You may have oilier skin. You may have drier skin. You may want to kind of pick up the sag of your neck. Not you, because your neck's good. But generally speaking, I think you need to individualize each person. Tell us about your skincare regimen.
Yeah, I think you touched on some great points. And whether you use our line or someone else's, I think Obviously what I'll talk about is outside of using a gentle cleanser and a sunscreen, because those are paramount. But I do think that
I forgot about the sunscreen.
Three staples are going to be vitamin C serum, a good moisturizer, and a retinol at night. Those three, I think, are going to be extremely important.
I forgot about that.
But do we have all kinds of fun things? Yes. One of my favorite products is called Rejuv-GH. It's a growth hormone analog. Actually, it's a peptide, which is very similar to a somatotropin. And, that growth hormone can do amazing things to help thicken the skin. And it's really more of a paracrine activity where you put it on and it can affect structures that probably are a little further away than what it could be absorbed to. And that's kind of what we're hoping with the Rejuv-GH. But I love the texture. It's the silky texture that goes onto the skin. And every time I wear it, I think, it looks better, whether it does or not. Or my skin looks better, whether, it actually does or not. As far as some of the fun things, we have, kind of a stem cell infused serum. It's not necessarily the stem cell aspect. It's the broth that adipose stem cells are, kind of brewed in that contain all the growth factors. And so we use that in our serum, which, is another thing I love. We have an antioxidant type serum that you put on your skin at night. So you have to imagine, you go through the day and your skin takes a beating whether you realize it or not. And now, again, antioxidants to remove oxygen-free radicals. Those are these little scavengers that run throughout our damaged particles, from the sun and environmental exposure that wreak havoc on the body, especially the skin. And so this is something that can help combat that. I agree with you. I think, the polish is such an important aspect because it is a micro granular size where it feels like silt. There's some products that you put on your face, it feels like you're rubbing gravel all over it. And, I would say, you should at least use either an enzymatic exfoliator, or which we have those as well. That's in our Resurface and Restore pack. Or you use a mechanical one. And this is one of the best, I would say the best mechanical exfoliator on the market. And use it at least once a week.
It's so good, we're sold out.
Yeah, I know. It's
it really is.
For those of you who are acne prone, so let's say our listeners are younger and you're still developing acne, things like that. Our Resurface and Restore pack is one of the most amazing little kits. And basically it is these little peel pads that you put on your face, and they contain multiple different acids. So from glycolic, citric acids, some of the natural as well as science-based. And then you put it on, leave it on for 2 minutes, and you feel your skin tingle, and then you neutralize it with a peptide milk. And that alone can help balance some of the bacteria that's on your face, and it also helps enzymatically degrade some of the dead cells. So that's something that can easily be used because acne is such a huge problem. And so a lot of it is dietary related. Some of it is, genetic. So that's something that can help. So that was my long-winded answer.
Nope,
there were three
perfect.
things that were really important. That's vitamin C serum, a good moisturizer, and a retinol at night. But there are so many great things that you can use depending on your skin type. So if you have questions, you can email us.
And we'll keep hitting on this stuff over and over again because we are always developing new products. And that's the beautiful part about making your own skincare line. We're constantly evolving. So if there's something that you guys think we don't have, or if you want us to formulate something new, we can always look into new stuff. And we really are constantly on a weekly basis trying to come up with new solutions to problems, especially when it comes to skincare. The one thing that I did leave out that's probably one of my favorite products is the lip plumper. Now, just a little bit of this lip gloss will give you a tiny tingling feeling in your lips and give you just enough of a pop, where I have lost some patients to lip filler because of this lip gloss. It really works well, and it's temporary. You don't have to get needles. I'm not telling you that I use it personally, even though I do have
looking pretty
thin
full over there.
Even though I have very thin lips, but it's really a fun thing to use. It's funny because my 16 and 18-year-old niece love it because the last thing they would do is go get lip filler.
Yeah.
So it's a fun way to play with some of these skincare products and make yourself feel and look a lot better.
Yeah, listen, I think, the important points to take out of this are our little pearls. We have treatments for any skin type. So regardless of extremely light skin or extremely dark skin, we have options for removing pigment, smoothing out the texture of the face, reducing fine lines and wrinkles, creating volume where it's been lost. And then we can set you up with ways to maintain your skin the way you want it to look. And everything's going to be tailored per individual because we're all different.
A couple take-home messages before we sign off is, number one, prevention is key. We talked about that before. However, if you don't prevent, we're here to fix. When it comes to lasers, always, always, always do a test spot. Regardless of who's doing it for you, if you're trying to get pigment removed, do a test spot. Come back the following week and do the rest. Make sure that there wasn't an adverse reaction and your body didn't really kind of respond to it. Third, always pre-treat if you're doing a laser. We talked about Triluma. Each office has their own little kind of pre-treatment protocol. The other thing I would add to that is if you are prone to getting cold sores or any type of herpes simplex virus, always take your medication before you have a laser because the laser can actually aggravate it and bring it out. And lastly, go ahead.
No, I was going to say, excellent point. I can't hammer that home enough. That last one, which was pre-treat your skin. If you're having microneedling, laser, plasma pen, anything, and you have any pigmentation on your skin, it cannot hurt to pre-treat, to just try to eliminate post-inflammatory hyperpigmentation because it's so difficult to get rid of.
Very hard. Once you cause the problem, it's almost harder to get rid of. And then lastly, have a good regimen, stick to it. What I said earlier about wiping off makeup, it's the same thing for men. Just clean your face. It's really simple. I know we're in this world now, we're constantly washing our hands. Our hands are getting really dry. When you clean your face, it's going to get dry too. So moisturize after. And then use a nice skincare regimen. You can go super simple or you can make it a little bit more tailored to your needs. But I think, if you've got any other questions, I think we told you enough to kind of fill up how to non-invasively keep yourself looking good.
Definitely. Well, listen, thanks for listening to us. We hope we are teaching you something. Again, this is Forever Young. I'm Dr. John Layke.
And I'm Dr. Payman Danielpour. Listen in on the iHeartRadio app, Apple Podcasts, or wherever you listen to your podcasts.
See you soon.